Hello everyone, and welcome back to Autonomia, the show where we bring ideas from the libertarian left to everyday people, and foster conversation on what we believe in hopes of proving that we all have far more in common than we are trained to believe. My name is Hayward, and I am your host. As always, our intro and outro music come from a song called A Bigger Cage is Still a Prison by System Failure. If you'd like to look up this song, the band spells System, C-I-S-T-E-M, for political reasons.
There's nothing I want more than to sleep under the night sky. Hear the animals as they go about their lives. Feel the fire warm my body, feel the mud under my toes. But tonight this cell keeps me enclosed.
Hello everyone, just jumping in to remind you this is part 2 of the 2-part episode with Doc, where we discuss the history of unionism and how it might relate to the left and right-wing divide. We also have a discussion on the American healthcare system and some of the intersections between the history of rebellious unionism and the history of addressing the shortcomings in American healthcare. So this episode launches off more or less where the last one ended, and unfortunately there's a bit of wind toward the beginning, but we clear up the audio for the most part toward the end. So I hope you enjoy it and find it interesting.
The trees form a secret green embrace, their arms beckoning to swallow me whole. I want to climb over these rooftops and over these fences and escape to the places none of these guards would go.
Reference or something, I had no idea. But anyway, so you might know what this person is called. I got to the ER and I went into a little room where they took my information and put the thing on my finger. Mm-hmm. I don't know if that's like a receiving nurse or something.
That's probably a triage nurse. Her job is basically to see how bad you are, and unless you're actively dying, you're going to have to wait. And
right.
Unfortunately, there are a lot of folks in the United States who complain that, if we didn't have this healthcare system, I've heard this a lot of times, if we didn't have this current healthcare system, wait times might be longer in the UK, or, as they are in the UK or in Canada and so on, which is true because if you're going to an emergency department for a primary care level thing, like a cold or a flu, or your baby has a fever and is breathing fine, or whatever the case might be, you're going to have to wait because that's not the purpose of an emergency department. An emergency department is there to stabilize emergencies and get the person who experienced that emergency to another level of care, admitted to the ICU or sent to their primary care, or whatever the case might be. The problem is primary care in this country, your average country doctor or your family doctor or whoever, is so underfunded, and therefore there's such a shortage of primary care workers that folks end up turning to the emergency department for primary care level stuff, for non-emergency care, and as a result costs go up, wait times go up, and it's only to the benefit of health insurers and the managers of the hospitals. It's certainly not to the patients or to the health workers.
I don't know about you, Doc. I'm pretty sure I've never had to wait for American healthcare, ever. I've only ever been seen immediately and received prompt and affordable care, and I felt like all the health workers were super well-rested and super energized and ready to take care of me, not overloaded or overworked at all.
And always paying attention to what you need because they had the time to do thorough assessments and so on. And
yeah,
absolutely.
I feel like it was perfect, and so while I was not waiting a long time to be seen for the significant holes that were in my hand and leaking blood all over the place, Black Panther had just come out as a movie, and the triage nurse, who I just remembered what that was called, he was nice enough to clue me in about the Black Panthers, because I'm just some random guy, I don't know anything about the Black Panthers. And so what I learned from this guy is that they were the black equivalent of the KKK, and they would just kill you for not being black, which is, of course, why there are no more white people in this country.
Obviously.
And this is a disturbingly common belief. That isn't to say that there wasn't militancy in the Black Panthers, but that's just an unbelievable misrepresentation of who they were as an organization. And actually, a lot of what they did and the stuff that you never hear about is part of what motivated Doc and I to form the organization that we formed to deal with some of the health and other crises in our community. Because, of course, the problems in American healthcare aren't super new and have been around for quite a while. And so maybe the Panthers, like the Young Lords, had like some programs that you might not hear about in history class or anything ever.
Yeah. So they did a bunch of things to take care of the health needs of their communities. The community I'm most familiar with that they helped was the Chicago branch of the Black Panthers, which was led by Chairman Fred Hampton. And among other things, they instituted a community-wide testing clinic for sickle cell anemia, which predominantly affects African Americans. Mm-hmm. And so they had free screenings for anyone who wanted them. They also ran community breakfasts, which the only thing they wanted to do was to feed kids in their community so that they would do better in school. And there's a fun anecdote I read about 6 months ago where the night before the first free breakfast program run by the Black Panthers, they were storing the food in a church basement, and members of the Chicago Police Department broke into the church basement on the orders of the commissioner and so on. They broke into this church basement and urinated all over this food. Unfortunately, one of the caretakers of the church happened to turn on the lights and see members in Chicago PD sweats urinating all over the food. And so the off-duty cops ran out in terror. And, of course, the police denied everything. And the expectation was that the free breakfast program would be shut down, because how could you replace all of this food at the last possible second? Well, what the Black Panthers did was they simply went in front of the community and told everyone and their mother, hey, the police tried to urinate on food for your kids in order to stop us from feeding them, and we would like to feed your kids. So if you wouldn't mind helping us, we would love to take some food donations. And they ended up having more food to give away than they had urinated on by police officers to begin with.
It sounds to me, Doc, like you're describing this in a very unfair way. It sort of, to me, sounds like the police were trying nobly and valiantly, as they have always done throughout their entire history, of defending the community and their members from eating food. To me, it sounds like they definitely weren't functioning to uphold a system of commodity life that the people that give the police orders benefit from. I don't think that happened at all.
It never happened.
Now, did this happen before or after Fred Hampton, Chicago leader of the Black KKK, apparently killed all the white people?
This happened before that.
Before
that, yeah. And it definitely is not at all related to Fred Hampton being shot in his bed 21 times.
Right.
with his pregnant girlfriend next to him by FBI agents and Chicago PD members.
And this is the same Fred Hampton who never tried to reach across racial and cultural lines on a shared basis of class unity.
Right.
There's
no video anywhere of Fred Hampton and the Black Panthers hanging around with a group called Young Patriots of random white rednecks. There's no video of this anywhere at all that you can definitely not easily find on YouTube if you'd like.
Right. Definitely not. Okay. So these folks were clearly terrorists, definitely should have been apparently massacred.
God forbid we feed our kids.
God forbid you feed the children.
Right.
God forbid you foster an organization that exists outside and in at least philosophical opposition to the dominant structures of life today. But I've heard these fake news rumors that in addition to helping people eat food, the Panthers also, as you touched on, did some sort of health care? Sickle cell anemia?
So they ran clinics, not only for sickle cell anemia screening, as I said before, but they also ran direct care, like primary care teams. So they would reach out to black health workers in this community and were like, hey, there's a bunch of people who, for example, grandma next door has diabetes and she needs help maintaining her blood sugar levels and so on. This woman down the street has COPD. Oh, this person a couple streets over broke their leg and needs help getting back on their feet, literally, and stuff like that. And so they were basically maintaining autonomous healthcare teams for their community that took care of their own community, regardless of what the hospitals and so on wanted, or what was to the benefit of the executives of the hospitals and health insurance companies and so on.
Well, how would the executives get another car, Doc? I think you're not taking that into account. These radicals that are using volunteer health workers to do health work outside of the for-profit system seems like terrorism to me.
I mean, if it is terrorism, it sounds like then my personal history of being harassed and followed and assaulted by members of my local police department while medicing at community events or doing rounds with myself and my team, I must have deserved it. I must have been committing some sort of horrible crime against humanity.
Because of course, you, a committed terrorist,
right? Obviously,
decided to address some of the difficulties that we're actually going to talk about more seriously, perhaps at some point during this episode, maybe. It seemed like, hey, there's a lot of people that are not getting care. Hey, our health system is overburdened because it's structured in such a way that people are... Because it's structured in such a way that prevents people from going to the right departments and just creating a whole lot of headache. And so you being a committed terrorist and a healthcare worker, because those often go very well together.
Obviously.
Said, hey, I have a wide range of knowledge and skills, and I'm out among the community frequently enough. Maybe I could just, I don't know, do something?
Right, like maybe I could just do the thing and help some folks, and I've been doing that for a number of years. Yeah, on a more serious level, I haven't exactly sat down and crunched the numbers, because why would I do that? Who would I be crunching the numbers for?
Right.
But I've certainly done a fair bit of work at every time I meet someone new. I try to get a health history on someone to the extent that they're comfortable talking to, the helpful, if slightly overbearing medic at times. And I've had cases where I've diverted folks from going to the ED because it was something that I could easily take care of. I've done hundreds of wound care cases in the past 3 years easily. I've responded to allergies with anaphylaxis and treated it with EpiPens. I haven't had to Narcan anyone yet, though I always carry Narcan, and so do all the members of my team. I've assessed and diverted a meningitis case at one point. I'm not legally allowed to say that it was meningitis. I will say that I suspected it was meningitis, sent the person to the community health nurse at the local soup kitchen, and it turned out to have been meningitis. And so I ended up escorting that patient to the local clinic, and he ended up getting diverted to the ED. Now, this is a case where the ED was used correctly. It wasn't used just because the person had a headache and some neck stiffness. He was assessed elsewhere, and then the people who had assessed him, which included me, concluded that this person probably had meningitis, which is a very serious bacterial infection of the upper spinal cord and brain, and that he needed emergency treatment as soon as possible.
So it seems to me like you are providing a service that is not only beneficial to the people that are out in the streets, but also it seems like you are also helping this system be a little bit less convoluted and dysfunctional, and maybe the people that might be having a more serious injury could have an easier time accessing care, which is interesting because it almost seems like you, a random person, is able to better take care of a system than the system itself. Hold on a second, we're gonna pause. Hi there.
Sitting here, I prepare myself for the future, when instead of 1 month I could be here for years. Would I lose hope? Would I take my life? Or would we find a way to break ourselves out of here?
Right. Excuse me. Yes, boss.
So, sorry everyone for the brief delay. We are actually at our monthly giveaway down in downtown New London. We give out food, clothes, all kinds of stuff, whatever we can gather throughout the month. And people came by, and we had to talk to them for a little bit. But yeah, so what we were getting at is it sounds like you're doing a pretty valuable service for the healthcare workers that exist within the system. I mean, it's almost as if a little bit of volunteer work outside of the logic of commodity can actually really help people that are operating as part of the system as well.
Yeah, I'm expecting my medal from City Hall any day now. So.
Well, yeah, I think the best medal you can expect to get for now are handcuffs.
Quite possible.
But yeah, I mean, it really seems like you're starting to address an issue that the system and the government itself is either unable or perhaps unwilling to address.
An American by the name of Sinclair Lewis once said, "It's hard to get a man to understand something if his salary depends on him not understanding it."
Yeah, and you know, one of the things that I'd heard from you pretty early on in us being friends was talking about this thing called single payer, and knowing basically nothing about healthcare policy, to me that was just thinking there's one person paying for a thing. Like I didn't quite know how to understand what that even meant. And so nowadays, with the Sanders campaign catching on and this Medicare for All / single payer thing like buzzing around in everyone's heads, perhaps you might be able to fill us in maybe about some of the facts and why someone on the left might actually support this Medicare for All system, because I don't know jack about it really, and I know you know more than I do, which is why you're here.
Right.
So perhaps you can help demystify this a little bit for us.
So I would begin by citing the fact that the fight for a single-payer healthcare system model has been going on in the United States since around the same time Britain instituted its National Health Service, which was in 1947 or 48. A single-payer healthcare system basically just means that there is one pool of money for healthcare resources for the entire country. For the UK, that's for the entire UK. For Canada, it's province by province. And for the United States, it would probably be state by state as well, with some federal oversight. And so everyone who pays taxes, which is 99.99% of folks listening to me explain this right now, you would pay your taxes would go into a big pool of money, and that big pool of money would also have the ability to regulate drug costs, which would drive down drug costs, because the reason drugs are so expensive is because the money that's spent for these over-expensive drugs falls into the pockets of pharmaceutical executives. So this one pool, this single pool, we'll call it a single pool for folks to understand this better, the single pool healthcare funding would then fund everyone's healthcare, and it would be at cost as opposed to 1,000% or a 10,000% markup, and you would not be in a situation where you would be charged $800 for 2 Tylenol in an emergency department.
Yeah, so as we know, the American healthcare system is the best ever and has no flaws, and it's fine, and you're a dirty commie. But one of the things that I hear you bring up when you talk about the pool, I've heard this term risk pool when hearing about the private insurance industry, and one of the...
I was hoping you'd bring this up.
And so one of the reasons it's in, I hear you say you hope I brought it up, so if I go in a different direction than you wanted, then let me know and you can bring it back to that. But one of the things that I hear and think about when they talk about a risk pool isn't that part of the reason why a healthcare company, a healthcare for-profit company whose executives drive fancy cars off of your premiums, is that the same thing that prevents people from getting healthcare that have pre-existing conditions?
Yes. So the reason why health insurance as a phrase should really have the word insurance put in quotes is because insurance is meant to protect you from a risk. So the reason you buy car insurance is so that on the off chance and totally preventable situation of you getting into a car accident, you can have protection from the costs of repairing your car or someone else's car, as opposed to you footing the bill yourself. The reason that doesn't work for healthcare is because there's a small chance that you get into a car accident if you pay attention on the road and whatnot. Whereas the chances that you'll utilize the healthcare system at any point in your life are basically 100%. You will go see someone about something at some point. There's no risk there for you to insure against. It's a certainty. And the ability of having middlemen between yourself and caregivers who just line their own pockets with the money you pay to protect yourself from these exorbitant costs is really, really disgusting, and something that most of the modern capitalist world gave up on years ago in order to keep capitalism afloat. The United States is kind of an outlier where its healthcare system is so divorced from economic reality, but is so entrenched at the same time that this horrible, disgusting system is just, for all intents and purposes, is going to be there regardless, even through something as dramatic as, for example, the Affordable Care Act in 2009, so-called Obamacare, which, among other things, made it mandatory for folks to purchase private insurance, which was a bonanza for the health insurance companies. They loved it.
Yeah, I bet. It's sort of an interesting hybrid you have there that almost seems to give these people even more money. And so these healthcare companies, they make unbelievable, or I should say insurance companies. These insurance companies are making unbelievable amounts of money, and one of their jobs is to deny claims.
That's how they make their money, by denying claims, so they don't have to spend the money that they make.
Right, and under the pure logic of that business model, it behooves them to deny claims as much as possible. So it could be said that they are a company that works in the healthcare field that isn't necessarily involved with healthcare in any way, shape, or form.
No, not at all. And
then, of course, you have co-pays, and which you pay in addition to your bills anyways. I remember being under my father's insurance when I was younger, and he was paying $2,000 a month for our family to be insured, and every time we went to the doctor, we were handing over a $100 bill as a copay.
Right, and I've heard the logic of copays explained, where you have to have some sort of cost invested in going to see the doctor, or you might just go see a doctor over frivolous nonsense. Now, in countries where they don't have copays and they don't have private health insurance companies, like Britain, which is a well-known Stalinist hellhole run by godless communists,
right,
and Canada, which is basically North Korea,
right, right,
they also coincidentally tend to have much lower healthcare costs and better population health outcomes overall.
And so when you hear constantly, especially on the right, but actually a surprising amount among liberals as well, that this is going to drastically increase our healthcare costs, if I hear that without really starting to explore it, I can see how that might make sense. But then when I wonder, how will this system reduce our costs? For example, caring for people that are uninsured to begin with, or caring for people that, what was I going to say?
I could just explain how costs go up if you'd like.
Yeah, but so they say that costs will go up for everyone because they'll be paying more of this money in taxes, and they say that it's going to cost a tremendous amount of money to provide this health care. Yet it seems like other countries will have better outcomes with a lower total cost. So is there a number like missing in there that prevents media from getting an accurate description?
Well, there is. I've heard it said on, for example, MSNBC, oh, this plan would cost us, $6 trillion a year. And that's true. It would cost $6 trillion a year overall, but the United States spends about 3 or 4 times that a year on its healthcare system, and the costs continue to spiral. And the reason the costs continue to spiral is also related to the reason why more and more folks are lacking in health insurance. So the basic mechanism is this. This is how it basically works. Emergency departments in the United States are legally obligated and ethically obligated professionally to treat whoever comes to them for service, regardless of if they're insured or not. So what happens is, when someone who's uninsured goes to the ED, as they will, again, inevitably do, you will need health care at some point. When this person goes to the ED for a severe crisis or for a non-emergency, that cost will get passed on to folks who have health insurance. So the health insurance companies, who obviously are not fans of the situation as they have to spend some money, will pass that cost on in the forms of premiums, which is just how much you have to pay in order to use your health insurance. And you might have a deductible, which is where you have to cover a certain amount of costs in the healthcare system yourself before your insurance kicks in. That could be $8,000, $10,000, $20,000, whatever the case might be. And so when this cost get passed on to you, the person with health insurance, your health insurance rates are going to skyrocket. And when that happens, you suddenly can't afford your health insurance anymore, which means that you don't have health insurance anymore, which means that you have to go receive uninsured treatment, which means more and more folks are receiving this treatment and the costs are getting passed on to more and more health insurance companies. And it just spirals and spirals until fewer and fewer folks have health insurance, and the system continues to get so expensive, while the metaphorical and literal pockets of the folks who run these companies are just getting fatter and fatter and fatter until they can't even walk, and the whole healthcare system collapses like a house of cards.
I mean, it does sort of sound like the situation you're laying out might be something like a collapse eventually, because it doesn't seem like a sustainable model.
No, it's not.
From the window, I hear the aching groaning wind. It forces its way through the cracks onto my skin. I long to climb out, to be swept up in its wrath, but I can't break through the bars that keep me in.
Okay, warmth. Ugh. So one of the things we were talking about before someone came back in to grab some free stuff from us was the issue of other countries and people from those countries not quite understanding what's happening here. You know, you see people that self-identify as capitalists from Canada saying, like, what are you people doing with your healthcare system? And that brings up the question, is capitalism the best solution for every single thing ever? And a free market libertarian would say, without even thinking about it, yes. And other folks suggest that perhaps not everything or anything best fits under the logic of commodity. And with something as essential as health, you know, staying alive, perhaps there's a better way that we can do this. But, you know, one of the things that we hear constantly, especially that I hear constantly on the right, is how much more expensive this will be for everyone. And it seems, and I don't have all the numbers on this, but it seems like everywhere else manages to do arguably better care for less money, which makes me think about, I heard Sanders on occasion mention middlemen. And it seems like this for-profit industry that's making gobs of money and then taking a percentage of the money that they make and actually bringing it toward doing what they're supposed to be doing, which is making sure people have access to care, might not be the best model for health in this country. I mean, what do you think about the idea of removing a middleman? Because that kind of seems like what I'm hearing from advocates of this Medicare for all / single payer type of system.
Yeah, I don't think that people who have no training in clinical care should have any seat at the table as far as delivery of resources or financing or anything else. I don't have any respect for a business school MBA graduate at the bedside. I've never been standing next to someone, you know, treating a giant bleeding wound and been like, hey, quick, hand me the MBA you got at Harvard, you know. So anything that would remove the role of the folks you described as the middlemen would certainly lower costs, because the funding would no longer be diverted straight into their private bank accounts, but would go towards the financing of medications and needed surgeries and stuff like that.
So you could definitely argue that this system as it is tremendously wasteful, and from a standpoint of fiscal from a standpoint of fiscal efficiency, it seems like our system is hemorrhaging money in ways that don't necessarily help this system provide care.
Right. No, they absolutely don't help this system provide care. It's been shown through countries that have more single-payer style healthcare systems, like in the UK, that to the extent that you try to privatize that system, your costs will go up and your outcomes will plummet. When Margaret Thatcher was Prime Minister in the UK, even she didn't have the audacity to try to end the NHS, because she knew that if she did, there would be riots in the streets, because it turns out when folks have access to quality care, they tend to like that, and they will defend that if they need to. But there's been over in the UK a slow, long-term attempt to privatize the NHS, and now with Brexit, one of the conditions of a trade agreement between the UK and the US is opening up the NHS to American insurance and pharmaceutical companies. And To long story short, don't privatize a public healthcare system, and ideally don't have a privatized healthcare system to begin with. It does not end well.
Well, I mean, it seems like the people that make unbelievable amount of money on this have been telling me for quite a long time throughout various forms of advertising that it would be the worst thing possible to have public health care. It seems like you can trace money that goes into these advertising campaigns to eventually people that make a lot of money off of this. Do you think it's possible that the campaign of public relations that is demonizing this alternate way of organizing healthcare might have a vested interest in things staying the same way that they are, which is to say, people dying of not having insulin?
Oh yeah, no, I would say not only is it possible that a lot of folks are benefiting from the system the way it is and are spending advertising money and buying politicians and buying talk radio hosts and so on to make sure it stays that way. It's not only a possibility, it's an absolute certainty.
I mean, it seems like America definitely has no history of lobbying at every possible industry in every possible direction to buy both government and media favor. That's definitely never happened before, because definitely our media corporations aren't owned by like 15 people or something. It's definitely impossible that, you know, media companies owned by billionaires, they're friends with other billionaires, don't do other billionaires favors. But, you know, you think about someone trying to get insulin, for example, and you probably know more about this than I do, but I seem to remember that the people that invented insulin wanted it to be free because they invented it for the good of people that needed insulin.
Right.
And nowadays it's like, what, $700 in some places?
Easily, depending on the health insurance company you might happen to have and
or don't have
in a lot of cases and so on. But yes, the folks who had first synthesized insulin refused to patent it and tried their best. I believe it was invented in like the 1950s or so.
Something like that.
And they did their best at the time to get the information out as widely as possible so that folks could have access to insulin and have the ability to make it. There is a organization I'm aware of called the 3 or 5 Thieves Vinegar Collective. They're a bunch of pharmacists and chemical engineers and so on who do their best to make DIY pharmaceuticals, so you can synthesize them at home using your basic high school chemistry knowledge. And I know that they've made a DIY generic EpiPen that they call an EpiPencil. I believe they are working on insulin, but you would best be suited to go check with them about that.
And so when you have a system and sort of a social context where people are dying from not having insulin or having to choose between rent and insulin or some other medication that costs a crazy amount of money and insulin, and you have this other angle where people are basically guerrilla making DIY medicine at their house, perhaps it might gesture toward the fact that we don't have the best and most efficient system. And especially with insulin, given that the original people that made it wanted to make it free because they were trying to help people, and it's later been privatized and now people are dying as a result of the privatization, it seems like it might gesture toward there being a serious danger in privatizing medicine and healthcare in general.
Yeah, there is absolutely a serious danger in doing that. I've been involved in treating folks who are suffering from opioid use and recovering from opioid addiction and so on, and there's a constant shortage of both funding for psychological counseling for folks, like talk therapy, groups like that. There's a shortage of medication-assisted treatment for helping, folks go through buprenorphine therapy and so on to wean themselves off of opioids gradually. And there's been a long-term shortage of Narcan because health insurance companies and pharmacies have had to really be pressured into not even providing free Narcan, as a lot of community organizations now do, but just providing them at cost or slashing their profit margins. And that's just not something that folks who stand to make a gigaton of money off of the healthcare system as it is are going to want to do, regardless of how severe we all know the opioid crisis is.
Well, I mean, it seems to me that this for-profit medical industry is not necessarily conducive to fostering public health. To talk about what's happening very recently, we have this virus that everyone's afraid of that might not necessarily kill a whole ton of people, but it's going to probably cause a lot of serious problems, especially with supply chains being interrupted. And you have a system now where people are being forced to go into quarantine and presumably not getting paid at their job to do so, when the average American can't afford a $400 emergency, missing out on 3 weeks or more of pay. But also these people are apparently being charged for their mandatory stay at the hospital. It seems like this system is incentivizing people to do the wrong thing from like an epidemiology perspective.
Oh yeah, no, there's no way that the American healthcare system as it exists is going to be prepared for something like a coronavirus outbreak. In 1918, during the Spanish flu, healthcare was a lot more affordable at the local level. It was more decentralized and it was way less bureaucratic. And even then, the 1918 flu almost brought the whole thing to its knees. I was reading a book a few years ago that was recounting the history of the situation back then from folks who were treating patients at the time, and one of the contributors basically said that the world civilization in 1918 was like 3 weeks away from collapsing entirely. That's not to say that I believe that's what's going to happen with coronavirus now, but even a minor epidemic is not something that folks who suddenly face $10,000 bills for being locked away at gunpoint for 3 weeks are going to be prepared for.
It seems like a really profound indictment of our medical system that you have companies that, at least theoretically, have the ability to contain and or hopefully eventually treat and cure this illness, but they're literally saying, no, but you have to be able to pay for the cure. I mean, it seems to be nakedly apparent here that if their goal was to actually make people better and to foster public health, then when an epidemic or a pandemic is on the horizon, they might want to, I don't know, get the care out there. But it seems like their goal is to make money through healthcare rather than make healthcare happen.
Right.
You know?
So their goal is to make money off of healthcare rather than, making healthcare great. You can't make it great again because it was never great to begin with, but making healthcare great would be a fantastic goal. But I wanted to point out real quick the distinction between healthcare in a publicly funded clinical care and public health as a discipline. Public health means more surveillance and prevention work, which tends to help to prevent epidemics from happening in the first place. And by coincidence is something that in the United States has been woefully underfunded for hundreds of years, going back to the times when nurses would have to go out and open their own clinics in slums just to treat people whose teeth were falling out and so on. So the CDC budget was slashed the last few go-arounds, and not only is the clinical side of the healthcare system underfunded, but the surveillance and prevention side that might theoretically help prevent massive viral outbreaks from getting out of provinces in China to Los Angeles and New York and Hartford and so on. That part has been severely underfunded for decades also. And don't be surprised if that comes back to bite America in its rear end.
Yeah, I mean, I think a lot of people, at least to some degree, even if they don't necessarily talk about it openly, are willing to admit that our system is so absolutely busted that it can't continue as it's continuing now. I mean, I've been hearing for close to a decade now that, for example, Alzheimer's is going to eventually collapse our medical system. And that's something that I think if we ignore completely, as many folks seem to be content to do, we're going to have an increasingly worse problem as time goes on. And even though this current virus might not be as severe as a theoretical future one could be, it can really start to lay bare some of the issues with our system, and it can help to provide a really good case study to show that this system is operating on a basis of profit rather than prioritizing care itself. And you can't claim to be in the healthcare industry if your primary objective is profit, simply because that profit will always be your primary objective. And I mean, a lot of people especially on the right or sort of the pro-capitalist end of things will say, well, no one will ever do anything without any sort of profit incentive. So I can only assume that you drive a very nice car, that you live in a very nice house.
Oh, I'm definitely not living in a tent. I'm living in a mansion down by Long Island Sound. I'm doing fantastic, and I definitely don't view what I do as more of a calling or, in a less serious way, maybe a hobby.
Right.
As opposed to something every time I'm treating a homeless person, I make sure that I get $50 up front just to make sure.
Right. And definitely people have never done anything in history without the motive of some kind of profit, because apparently humans care about nothing other than profit, which is why the people that invented insulin wanted their product to be free, which is why I've literally lived in places where money wasn't even a thing, and somehow they managed to find these really great ways of living. It's definitely the case that humanity has never done anything without a profit motive, which is why we didn't exist almost 2 million years before the invention of money.
Right. So there were definitely never medieval nursing orders like the Knights of St. John, which was not a real thing that you definitely can't go look up on Google.
Right.
They definitely did not run hospitals and treat poor patients and so on with surprisingly good nursing care for the time. Obviously, they didn't have the modern germ theory of disease or anything like that, but they still knew that, like, if you could eat well and sleep well and not lying around in your own filth, that you were probably stood a good chance of recovering for whatever mysterious ailment was raising bumps on your face or whatever the case might be.
And, you know, as a more recent example, you know, the Panthers were definitely making tons of money giving out all the medical care and running all the free clinics that they ran before they were all, you know, murdered and put in jail. That definitely, you know, was a thing. But of course, even nowadays, as this system is increasingly groaning and collapsing under its own weight, street medicine in general is actually starting to become a much more common thing. You know, this might have been sort of a niche thing quite a few years ago, but now it's seeming super common. So much so, in fact, that on the radio show that I go on fairly frequently, he has one of many doctors as guests, and this doctor was talking about street medicine in Haiti, saying it's quite common down there because they don't have the infrastructure to have a more formalized medical system, and even if they could, no one could afford it.
Right.
But he was saying, now that's happening in this country, and what does that mean? Well, let's connect the dots here. It means that we have an unsustainable system that's rapidly becoming like a third world area for most people.
Mm-hmm.
You know, it doesn't necessarily matter if you have the greatest medicine in the world if 80% of your population would go bankrupt just to walk in the door.
Right. I've heard this objection to more sustainable healthcare system all the time, where folks say, well, what about DI? What about research? What about R&D? What about new pharmaceuticals and all that? Where's the incentive for them to do that? And just to name another example, Cuba developed a vaccine against lung cancer. You do not get lung cancer. They also eliminated transmission of HIV from mother to child. They were the first country in the world to do this in the 1980s. And the United States does not have access to either of these things because of the embargo that's been going on for 60 years.
Well, you know, as we recently learned in the media when Bernie Sanders talked about the literacy program in Cuba, which of course you can have all of your own opinions about, but you can't ever have any sort of nuanced level of support or understanding for a government that is technically an adversary of ours. You couldn't possibly ever, I don't know, learn something from a society that's run totally different from yours and adapt successes that might have happened in those systems to your own advantage, because that would be crazy. And to merely say that, I don't know, Cuba has come up with some interesting things, we have to say, oh, well, if you even bring that up, you must be a card-carrying communist.
Right, obviously.
And anything that you say would be absolutely and utterly useless, and absolutely and utterly jail-worthy,
right.
frankly.
Well, I'm aware that podcasting is more of an audio medium for information, but for listeners who can't see me right now, I am wearing a stethoscope, and I forgot my Communist Party card at home, so that's just an oversight on my part. I apologize.
And by home, you mean your tent?
In my tent, yes, yes.
Right. Folks not in New England right now, it is late February, 29th of February, and it is extremely cold. Water is not liquid in this temperature. and our buddy Doc here, despite the fact that he lives in a freezing tent, still manages to do this care because, I don't know, maybe he likes people, and maybe there are more people like that out there. And maybe if our system didn't have everyone running around so hard just to struggle to make ends meet, perhaps you might have people that are actually being nice to each other because they're able to be. You know, I can think of a lot of people that would want to do a lot of volunteering work, but they have to work every waking hour just to pay their bills, or pay for their insulin, or pay for their medical debt, or any number of other possibilities. And, you know, that's another angle of why the left in general is very displeased with capitalism, because it controls so much of our lives. It's not great.
I mean, I certainly would not be averse to not living in a tent.
Right.
So I would like to be able to keep doing what I'm doing and not live in a tent. That would be ideal. But till that happens, I'm gonna keep on doing it because like you said, I like people and I like what I do, and I'm going to keep doing it. Yeah. And I've had days where I've had problems with people, like had an objection to people offering to buy me coffee for caring for them, let alone like a $50 upfront charge.
And for those of us that aren't aware in the listening audience, I'm a construction worker and I do a lot of scavenging, and I get all sorts of usable stuff from local job sites that they just might not need, or they order too much material, or there was a renovation perhaps. And what that turns out being is I was able to make several sheds and several tree houses out of the dumpster of one job site, and it's just about all to code. If I were able to, without having the houses that I build be literally ripped down the next day by the police, I would be building houses for people all the time because I love doing it. I love fixing people's houses and making a better situation for them. I mean, luckily Doc is in a situation where if he renders medical care to someone for free, the police don't come and shoot the person in the head. But if I were to be...
Well, you'd be surprised.
But if I were to be building a house for someone and just plop it on some vacant land somewhere, there's a extremely high chance that that house will eventually or very quickly be destroyed by law enforcement. So, due to the structure of this system, I literally can't do what I would love to do. And I have to think that Doc and I are not the only two people on the world that act this way. In fact, the more people that I talk to, the more people I realize that feel similar ways to that I do. You know, my wife is a dental hygienist, and she loves the end of it where she's like taking care of people and helping people out. And a lot of people might feel that way about their work. But the way our system is structured, most people don't have time to fully explore and fully access and fully express the passions that they might have because they're too busy just trying to survive. And if this system is just a struggle to survive until you eventually die, what's even the point? So a lot of people will say things like, well, how do you pay for this system? And there are many plans. The Sanders plan is the one we're most likely to encounter simply because that's our current political landscape. And it seems like he's saying he wants to put taxes on folks that are on the wealthier end of things, but he also wants to tax folks that aren't quite in our bracket. We're sort of on the sub bracket of brackets. But a lot of people listening to the show are probably in a bracket that might see higher expenses through taxation under Bernie Sanders' plan. And it seemed like his argument is that the waste that is fundamental to our system and the profiteering that is fundamental to our system, if that were removed, then it may be significantly cheaper, and you will probably, this is what he says, you will probably be paying less in taxes than you would have ordinarily been paying in premiums and co-pays and all sorts of other insurance fees. And I don't happen to know the numbers on this because I am very dumb. But perhaps you have at least some idea on where we might look to understand this?
Yeah, so a good citation for any existing single-payer system in the United States would be a country that is bigger than the UK but has a similar land size and population situation. So that would be Canada, Australia being the best examples. The one I'm actually most familiar with personally is, of all places, New Zealand.
Right.
I have a lot of friends down in Christchurch and so on. I was invited to serve as guest speaker at a conference of the Health Sector Workers Network, which is this big grouping of healthcare unions in New Zealand. And I was invited to go down there last April, and I couldn't because, well, I have no money, and second of all, because there's this little mass shooting that happened in Christchurch the day of that we had been scheduled to hold the conference, so that was inconvenient, to say the least.
Yeah.
So countries that have single-payer healthcare systems, they spend less, as I've alluded to. They have better outcomes, as I've alluded to. And as we all know, New Zealand is basically the same as Cuba. I mean,
Right.
this is well known.
Yeah, definitely.
So,
But yeah, so to a certain degree, when I hear people on the right, or maybe even in the center, be skeptical of Bernie Sanders' numbers and skeptical of saying, well, this would never, it would end up being so much more because the government is a massive bureaucratic waste pile. You know, to some degree, I have to be somewhat sympathetic with that, which is, and of course, to some degree, there's a leap of faith inherent in saying, okay, we're going to totally restructure our system and we're going to hope that it's going to work better. But luckily, it seems that it doesn't have to be a complete leap of faith simply because there are countries right now that are demographically, structurally, size-wise, similar enough to us that we might be able to infer that this may work in our situation. And a lot of people bring up the idea of wait times, and it seems like I hear a lot about that in the media, these same media companies that are owned by and friends with people that are at the very high ends of our society that might have a vested interest in things staying the same way. So I think it's important to take that with a grain of salt as well. Are there wait times in those places? I mean, probably. But also, I don't know if you've been through American healthcare recently as a working class person and not as a person that's very well connected. You wait. And then you go broke.
So yeah, to answer the are there wait times in these countries? Yeah, there are wait times. If you are not in an emergency situation, you're going to have to wait. If you have an elective procedure like plastic surgery, for example, you're going to have to wait. I'm sorry on behalf to the rich housewife in Beverly Hills who might have to wait for a breast augmentation that's completely elective, but if some poor woman in the Bronx is in the middle of giving childbirth, she's going to go, like if she's in labor, she's going to go ahead of you based on triage. We all of us as health workers have training in triage, and that basically just means that you assess the severity of need in the patient in front of you, and then you just assign them accordingly. The reason so many folks have to wait in the emergency department in the United States is because a lot of folks, for reasons I've already alluded to, use the emergency department for primary care, which is not what it's designed for. So if you show up to an emergency department with a flu, it's not an emergency unless you have pneumonia and your lungs are shutting down, so you're going to have to wait. But in countries where basic primary care is better funded and free at the point of care, folks aren't flooding into the ED with non-emergencies, and wait times are perfectly fine.
You know, one of the things that you brought up, I think is really important for folks to recognize in our system that for whatever reason is chronically under-acknowledged and absolutely damning, in my opinion. The child and mother mortality rate for birth in this country is enormous. I think they did a list. I saw it on TV recently, but it's been a stat that's been out for a while, and it listed a bunch of countries that have that have better maternal outcomes than we do, and it's Kazakhstan was one of them.
Oh yeah, absolutely.
You know, Kazakhstan,
yeah.
the field in the middle of the middle of Central Asia. You might remember Kazakhstan from Borat and launching that guy into space one time. Humor aside, how can we claim to be the best, greatest healthcare system if we have a higher maternal death rate than Kazakhstan? And I'm not trying to make fun of Kazakhstan, but come on.
Like, if you can't point to Kazakhstan on a map, but your country still has worse maternal and neonatal mortality rates than they do, that's a problem. See, personally, I have the crazy opinion as a medic and just as a human being that I'm in favor of limiting the number of women who die in childbirth. So that's just me. I'd ideally like for that number to be 0 or as close to 0 as possible. Crazy thought.
And then, you know, there's also the racial dynamic to it as well. You know, the maternal mortality among black women is, I don't remember the stat, but it's significantly higher, and that's absolutely horrifying. And you know, there's some long-standing racial stereotypes, apparently, like about pain tolerance to do with it.
Yes.
That just it's crazy that this is even still a thing in the allegedly greatest healthcare system in the world. There was a one recently where I think she had a cesarean and she had internal bleeding and lost I think it was 3 or 4 liters of blood through her catheter, and the husband kept saying, "Hey, something's going wrong," and they just ignored her.
Right.
She died.
Right. So in the literature, if you go look, you'll see an acronym SDH, which is Social Determinants of Health. I recently attended a talk on racism as a public health matter, and honestly, a lot of it was, studies and stuff I was already aware of, but it was a good review and nice to meet with other health workers on that basis and so on. But race is absolutely a social determinant of health, and so is gender. Women are routinely accused of exaggerating or lying, or just being hysterical. Pain is routinely undertreated among black patients, and it's honestly it's an outrage. It's disgusting, and it's unethical to boot.
And then we hear we have the greatest health system on earth, that we're paying 3 times the amount as 2 or 3 times the amount as Canada, something like that,
at least.
And yet we still hear this talking point perpetuated in most part due to people that are either at the top experiencing the actual greatest healthcare on earth, or they're perpetuated by the people that are allegedly purveying the greatest healthcare on earth. And this is not me saying that I'm mad at the people that are actually doing the healthcare work, because more often than not, they're super overworked, they're super tired, they're super in debt because of their student loans. I mean, there's so many levels of screwed up with this system that
To jump off of your point about the student loans, I'd like to remind our listeners that there's also a massive shortage of nurses and physicians and pharmacists in the United States, which personally I'm not an expert on wider policy, because I tend to just get my hands covered in other people's bodily fluids for my living and just for public service. But I'm pretty sure there's a connection between massive student loan debt and a shortage of physicians and nurses and pharmacists if it's too unaffordably expensive to enter nursing school or pharmacy school or medical school. Just a thought.
Yeah, I mean, there are so many directions in our system that the obsession with profit has really served to cripple our ability to have a functional society, and it seems like that keeps getting worse and worse and worse. And when you have the shortage of staff, you have people being overworked, and those people are trying desperately to pay off their student loans anyways, and you end up with a situation like where my wife and I, she almost died in childbirth a few months ago because the people were so tired they could barely do anything correctly. And I didn't get mad at those people, because I know they're going through terrible stuff too. I know that's a systemic problem that is absolutely outrageous, and it made me want to scream, but I'm also not going to chew the person out for something that's totally beyond their control. So I mean, it seems like we've pretty much got a taste of why this system is really screwed up, and why we might want to have an alternative solution, like a case-tested and case-proven method like single payer. One of the things that I thought is kind of interesting is you spoke to your healthcare worker friends in New Zealand,
mm-hmm.
and in America we exist in this capitalist landscape where almost all of our opinions, in at least some degree, and all of our worldviews are constructed by media entities and capitalist entities that have the money to put out enough media to create this narrative that everyone just repeats to each other and believes.
Right. I've had a hard time explaining to folks down on that side of the world how bad the American healthcare system is. Like, I was in a conversation once explaining how pharmaceutical advertising works in the United States, and I had people legit call me a liar, and they said there's no way that a civilized country would allow that to happen. And I'm like, no, that absolutely does happen here all the time. In most countries, it's illegal to advertise pharmaceutical products to patients, because patients are patients. They're average, workaday folks who don't have the training that we have. And so it would be grossly irresponsible to say, oh, here's this medication that just came out with horrifying side effects that we know of, and probably a whole bunch that we don't yet. But if this glossy advertisement makes it sound like something that might make your life better and give you a beautiful house in the suburbs, you should go talk to your doctor about it.
Do you remember that time that Purdue Pharma came out with an opioid pain medicine and then didn't advertise it to doctors to the extent where they were paying for vacations for them in order to write more prescriptions? Do you remember when they definitely didn't have emails that were revealed in a court case that showed they knew exactly how addictive it was and still pushed it on people, causing a nationwide opioid crisis and tens of thousands of dead people for their profit? You remember when that didn't happen,
right.
Because the American healthcare system would never let something like that happen.
Right. We live in the world's greatest healthcare system, as someone who's worked bedside and in the community for years now, I am fully aware of. That's a perfect background.
And capitalism definitely isn't something that allows absolutely monstrous people to make absolutely monstrous amounts of money while causing absolutely monstrous amounts of death for profit.
Right. Women definitely don't die horrible, needless deaths in childbirth every year in the United States. It's never happened.
Right. And so profit motive definitely belongs in medicine. I think would be like a good way to sum this up. Like definitely profit has definitely helped.
Oh
right?
yeah. If you should definitely invite the board of a major corporation to round with you on the bedside. If you're not wearing scrubs or a lab coat, you're wearing a 3-piece suit. That's fine. You should just walk right in. It's fine. Don't change into that gown or anything. I'm sure that airborne disease is totally fine, and I just don't know what I'm talking about.
So, as someone who isn't a healthcare worker, I have to say I would be definitely most comfortable if someone determining how much and what quality of healthcare I get went to business school. I definitely think that's probably the most qualified person to determine what sort of health that I get, and definitely doesn't have an interest in making sure that they just make money off of me and or my corpse.
Yeah, I mean, I don't have a good response to that yet.
I mean, one of the things that I've heard Doc say a few times over the past few years is listen to the healthcare workers that are actually operating in the system, and a tremendous amount of them seem to be in favor of this newly proposed system, or at the very least some form of it, or at the very, very least, this system is broken.
Yeah, the American Medical Association has a history of blocking single-payer legislation in the United States. I mean, they came out against Medicare in the 60s when that was still just a proposal. But recently, the American Academy of Physicians endorsed Medicare for All. The American Nurses Association has for a long time. National Nurses United has for a long time. And more, I'm not aware of what dentistry or pharmacy as a discipline, pharmacy organizations are doing as far as that goes. But for sure, major medical and nursing organizations are on board with a major revamping of the healthcare system.
Yeah, and if someone who exists in this system to one capacity or another every day has an opinion that says maybe things should change a little bit, perhaps at the very least we should hear them out, because maybe we might learn something. Because I don't know about you, average listener, you're probably also not a healthcare worker who probably also doesn't have an intimate knowledge of how this system works. So maybe we should have the humility to listen to people that work within the system rather than perhaps a pundit who is paid to read whatever is on the teleprompter and or have some opinions based off of what is on that teleprompter.
I've found myself in a position of explaining what's going on with someone's health on an individual basis a lot of the time, and sometimes folks will request a second opinion and so on because they're not sure that they're 100% comfortable interacting with you, or perhaps they're still in denial and they need further confirmation of this before they accept it and so on. So if I were to explain to you that you had this serious health issue going on that was continuing to get worse because of decisions you were making, and that if you didn't make minor changes around the edges to your behavior and to various aspects of your life, that it would ultimately kill you, you are perfectly within your right to not believe me. You could go ask somebody else, but if they tell you the same thing, and then a third person tells you the same thing, and then 8 or 9 people tell you the same thing, except for the person who's a friend of your uncle's or whatever, you might want to listen to the 8 or 9 who are actively telling you, hey, you need to do this, you need to change this behavior, or this will happen to you.
Yeah, and something worth considering is, I think, and I've said this several times throughout the various episodes of the podcast, I think anyone that has a different opinion should research the opposing point of view simply because they might have something that they might learn. And what we should have loyalty to is the truth and the pursuit of the truth. So we need to look up alternate perspective as a means of constantly checking our own beliefs. And if our own beliefs begin to fall apart in the face of new information, then perhaps there's something that we haven't taken into account. And I have to imagine that people that work in the system have a pretty good idea of what's happening, so they might have a valuable opinion for you folks to learn. So if you find yourself skeptical of this system or some version of this system, then maybe look up testimonies and perspectives from people that operate in a system like the one that's being proposed currently, simply because you have to be aware that in a for-profit environment with for-profit companies, you're not necessarily going to get the straight story from these people. You're not necessarily going to get an unfiltered lens. So at the very least, what you can do is get someone else's opinion that contradicts with that as a means of figuring out what you actually believe. Because if you're only going to get talking points that are almost certainly corporately influenced to one degree or another, chances are you're going to believe whatever that corporation wants you to believe. And in the case of healthcare, what they want you to believe is that the system that's making them tremendous amounts of money is what works. And there are probably multiple ways of running a healthcare system that aren't our current capitalist nightmare. But we wouldn't even begin to know if all we ever do is consume a corporate narrative. And that's hard to avoid in America because we are so hyper-capitalist that every narrative you get on any sort of major news entity is going to have some degree of capitalistic influence to it. And that's a very difficult position to be in. But we have the internet nowadays, and we can look up other people's opinions, and we can look up case studies from other countries, and we can try to figure out what we can learn. Because, like that whole controversy with Sanders in Cuba, there are things we can learn from just about anywhere. And if we are so full of ourselves that we would say we can't learn anything from anyone else, that's a ridiculous position, and it's anti-scientific. You can always learn something from somewhere even if you don't agree with it, because at the very least you at least understand what you're opposing, which a lot of people nowadays don't seem to even understand. I might talk to people about a whole variety of issues, and they'll say that the information I've given them they never even heard before, which is unbelievably frustrating, because I'll find people that I share a lot in common with that had no idea that we agreed on so much. In fact, before the discussion, they might have even thought of me as an enemy or even a crazy person. Like, you need to seek out people that have some type of expertise in this and seek out a diversity of opinion, because you might find something you never expected that you would find. And in a for-profit environment, your ignorance is their profit. Anything else on that?
No.
So, basically, we can sum this whole thing up to say, unionism, as we talked about earlier, has a history on the left, and it's been brutalized into a more centrist position, but that doesn't necessarily mean that it inherently aligns with right-wing values, because of what's left of it after right-wing values brutalized the life out of it. And you can see that most of the serious gains of the labor movement happened during a time where it was much more explicitly left. And in the time where it's become more toward the center, even people that are rank and file members of some unions are frustrated with the unions. Go figure.
Right.
And then in terms of healthcare, just something is very wrong in our system, and I think we all can acknowledge that. And I think we owe it to ourselves and to our neighbors and to our children to investigate what other countries are doing and find ways of adapting it. And you might decide, and we might decide as a country, that we want to not have a totally different system than what other countries have. But we know what we have right now does not work, and it is not sustainable, and it's letting people die at disproportionate rates to other countries for no reason. So we have to figure out something. And the best place to figure out where to start and what that something is to look at other countries that have solved the problems that you're still struggling with. I think we have a lot to learn from other places, and I think we need to have the humility to do that, because if we actually care about being the best country in the world or the best healthcare system in the world, we should take steps to make sure that that's actually the case, rather than just tell ourselves that while we all die of coronavirus or something.
Right. I would say that we have the potential to be among the greatest healthcare systems in the world, but anyone under the current scheme of things who tells you we have the world's greatest healthcare system either doesn't know what they're talking about or has a vested interest in keeping it this way, or both.
Sometimes both.
Sometimes both. But they certainly are not. almost certainly not in the thick of it, wrist deep in other people's orifices and body fluids the way I and millions of other healthcare workers in the United States are.
Kinky.
Didn't it just be like that?
But yeah, I hope this has been informative, and I hope this has given you some things to think about. This is a little bit longer than we typically make our episodes, but I think it's important information. And as I'm talking with someone that has a lot more information than I do on some subject, I want to make sure we have interactions that can help bring additional information and additional perspectives to you. So I hope you have something to think about, and I hope you do some research on this independently, simply because I don't expect you to believe everything we say any more than I expect you to believe anything you hear on TV. You should look up this stuff, and we are telling you this stuff because we happen to believe these things, and we feel like if you look up some more stuff, you might find that the facts tend to align more with us. I hope you find that, but either way, I hope you look that stuff up, because there's a lot to learn here, and you really should. So thank you so much for listening, and thanks, Doc, for being on the show.
Of course, happy to be here.
Good luck freezing and taking care of you.
I'll do my best.
All right, thank you.
'Cause there's nothing I want more than to sleep under the night sky. The animals as they go about their lives. Feel the fire warm my body, feel the mud under my toes. But tonight this hell keeps me enclosed. For if we don't have our freedom, if we are captured by their iron hands, then the vision for fire, it burns so much more bright. There's no justice in the system, a bigger cage is still a prison. Well, I hope that somewhere someone breaks free tonight.